All right, Ramblers, let's ramble. I am pleased and honored today to bring yet another Prometheus, someone bringing fire and knowledge to the masses. Dr. Peter McCullough. He's an internist. He's a medical doctor. He's a cardiologist, epidemiologist. He's a professor. He does it all. He has over almost 50 peer-reviewed publications on the early treatment of COVID. He is the most cited doctor on the early treatment of COVID, and he's here to talk to the college crowd today. Dr. Peter McCullough, how are you, sir?
Great. Thanks so much for having me.
It's been a crazy 3 or 4 years, hasn't it, from where we started to where we are now. Early on, when COVID had started, there was very little pushback with regard to the narratives, right? Whatever the narrative was, and then the vaccine started being rolled out. There was a group of doctors that were skeptical about it, and a few of you bore most of the brunt of that, I guess you could say. So Dr. Jay Bhattacharya, you, Dr. Malone. But now, a few years later, it seems like a lot of that has died down, and now you are, it seems, capable of going out and being more skeptical and talking, and people are online and they are questioning things. Do you see a change from when you basically were vilified at the beginning to where you are now? Have you seen any change at all in the atmosphere?
Boy, that's an interesting question. Thanks so much for having me on the program. And, as introduced, I'm a medical doctor, so I'm seeing and examining patients routinely, and I've cared for patients throughout the pandemic. I'm a former professor of medicine. I want to clarify that. But I can tell you, we're 5 years into the pandemic. I have never received a phone call or an email from a colleague who said, I disagree with you on the methods of early treatment or the safety data on the vaccines. It's so interesting. Yet there could be an anonymous account holder on Twitter who, would pile on a reply to one of my tweets with some expletives, some very unprofessional commentary. And invariably, that Twitter account doesn't show someone's face, doesn't give their real name. And if I look, they typically have very few followers, typically less than 1,000, sometimes less than 100 followers. So initially, what happened is, yes, we received these comments from these unknown individuals on Twitter. But I was, I think, among the first of the doctors you mentioned. I'm the only one practicing medicine, the only one widely published on COVID, approaching now 100 peer-reviewed papers and just numerous various forms of publications. I published an op-ed in The Hill in 2020 by invitation. Myself and Scott Atlas were the two academic doctors invited to write op-eds in The Hill on the pandemic. Atlas was focusing on contagion control, masks, lockdown, social distancing. And when we look back on it, contagion control was a giant waste of time because everybody got COVID.
Everybody got COVID.
The assumption of contagion control would be that you could avoid getting the illness. No one avoided it. So I'm so glad I didn't waste my time there. But I did spend a lot of effort on early treatment. And when we learned that the plan for the COVID-19 vaccines was to take the lethal part of the virus, which is the spike protein, the spine on the surface of the virus, to take the lethal part of the virus, and then the genetic code for that lethal part, inject it into the body, and allow that genetic code to have a free run in all the cells of the body, producing an uncontrolled quantity and an uncontrolled duration of this lethal protein. This was the most dangerous idea I'd ever heard of. I published an op-ed in The Hill in August of 2020. This is before they came out. And the title of the op-ed was The Great Gamble of the COVID-19 Vaccine Development Program. So you're interviewing the only person in the world that I'm aware of who, in writing big time, questioned the vaccines before they came out.
That's absolutely crazy. And Did you at what point early on did you start seeing that there were establishment people that were behind a concerted effort to actually smear you? Like, did you see
You
that
know,
really early?
in 2020, I had early on devised the first and most widely used multi-drug treatment protocol to help people stay out of the hospital, avoid hospitalization and death. It's copyrighted McCullough protocol. It was published in the American Journal of Medicine, still one of the most widely cited papers in all of the pandemic. So that was it was published in August of 2020. The op-ed in the Hill on the vaccines, August of 2020. I testified in the US Senate November 19th, 2020, and I received emails from the hospital presidents, and everyone took a half a day off. No one at my health system, and I was a major figure in a health system here in Texas, had ever testified in the US Senate. And so I had received congratulatory emails. And in a sense, I was held up as a hero. And then an attack piece came out from a Houston newspaper that said that I was pushing unproven treatments. The minority witness in the U.S. Senate was Dr. Ashish Jha, who's a younger, kind of lesser published person who had risen to the position of dean of the School of Public Health at Brown University. He published an op-ed in either the New York Times or Wall Street Journal, I can't remember which, where I was smeared as a snake oil salesman of the Senate, that I was selling snake oil. Well, I was advising on simple practical measures to reduce the contagion, actually the self-re-inoculation, like getting fresh air, nutraceuticals and vitamins, vitamin D, vitamin C, quercetin, etc. Over-the-counter products like aspirin, and then on to prescription drugs. And some of them were generic prescription drugs. Others were high-tech Operation Warp Speed products that came out. And so things started to turn dark towards the end of 2020. And then by February of 2021, I was marshaled into a room by two health system administrators that said, "Turn in your badge. We are not renewing your contract. You're effectively terminated." And I said, well, geez, the contract's, 24 pages long. There's a termination section. There needs to be, a board meeting with 2/3 of the board approving, the president approving. I said, well, where's the affidavit of the board meeting and the president approval? And the administrators told me, we're not following the contract. We're not doing any of that. And turn in your badge. In fact, they immediately locked I couldn't get any badge entry to the clinic. I had responsibilities the next day in the hospital. I couldn't get into the hospital to do my duties. I frantically made calls to try to arrange some coverage. So something turned dark, almost like a flip of the switch. Another inflection point was in the summer of 2021. If you read my Wikipedia page, through the summer of 2021, I had all these accolades. I had made major contributions in my field of heart and kidney disease.
No. It was sterling. It was absolutely sterling before COVID.
Yeah, I was the most published person in my field in the world in history on the interaction between heart and kidney disease. I published in New England Journal of Medicine, Lancet. 2019, I was a visiting professor of medicine and lectured in 2 divisions at Harvard School of Medicine. It couldn't have been a better academic career. And then in the summer of 2021, suddenly in Wikipedia, there was some Wikipedia editors. Again, they're anonymous. One of them was from Illinois. His name was the Alt Man, I believe. I assume it's a man. Made over 250 entries. And then suddenly my Wikipedia page said I was pushing conspiracy theories.
By the way, it still says that. I checked before the interview. I just wanted to make sure. I just wanted to see. And the lies and the smears are still there. And they're still lying about ivermectin, which is now approved. You're allowed to take ivermectin, correct? in the United States for COVID?
It turns out as we look back, the most powerful treatments were nasal sprays. Nasal sprays and gargles, nasal sprays of povidone iodine or xylitol. The major manufacturer of xylitol, the company called Clear, they're being viciously sued and pursued by the Federal Trade Commission right now. So the nasal sprays and gargles were the winners. We go through the nutraceuticals and vitamins. One of the major purveyors of vitamin D, Eric Naputi, was viciously pursued and had a massive financial settlement against him by the Federal Trade Commission. They were operating under what they call the COVID misinformation policy, the Federal Trade Commission. Then we get down to hydroxychloroquine, which was smeared with falsified papers in the New England Journal of Medicine and Lancet, the most damaging one in Lancet. And to this day, virtually every hydroxychloroquine paper has been massively pursued. The most recent one by Didier Riault in France, his group, Elsevier, has put a fraudulent letter of concern. And this is an analysis of over 30,000 patients. It's a valid paper. I'm one of the co-authors, and to show the worldwide nature of this. And then you get to ivermectin, which turned out of the oral drugs was far and away, in my experience, the most effective, rapidly active drug. A man your size, I would prescribe probably 36 milligrams a day for 5 days. We could extend it to 30. Those data were so powerful that in a paper in Chest, one of the best pulmonary journals by Dr. J.J. Roster from Florida, ivermectin in the hospital was associated with a 50% reduction in mortality. Now, this is a prospective comparative study. It's the best data that we had at this point in time, and it's safer than Tylenol. So once we started to learn the doses and how to prescribe ivermectin, and our pharmacy started to compound it in bigger sizes, it originally came in a 3 milligram tablet. We needed like 12 milligram compounded capsules. Ivermectin became the go-to drug. It was so bad that despite all the positive data, the National Institutes of Health guidelines said, do not use ivermectin. The FDA came out with a smear campaign in the major media and social media saying that it was only a horse veterinary medicine, totally misleading the American public. This was so egregious that 3 doctors, Dr. Mary Telly Bowden, Dr. Robert Apter, and Dr. Paul Merrick. Dr. Merrick, by the way, is the most published doctor in critical care in the world, they committed a lawsuit against the FDA, and in the proceedings, they prevailed. In the end, the FDA settled and said, okay, we'll take down all our false, misleading information about ivermectin. But to this day, if I wrote a prescription for ivermectin and it went to a standard pharmacy like CVS or Walgreens, they would reject filling the prescription.
That is crazy. That is absolutely insane when it's being used in countries with better outcomes than us.
True.
So why not look to those countries?
In India, big state in India, Uttar Pradesh, countries in South America. I participated in a manuscript with the Hondurans that were using a multi-drug approach. As we sit here today, every single acutely ill, high-risk patient with COVID-19 should have received ivermectin on day 1. Now, if they got to the urgent care or hospital, they definitely should have gotten it through the hospital stay. And, our federal agencies in the United States have us at 1.2 million COVID deaths. No one received it in the hospital.
Wow. So I guess you could say that by banning ivermectin, we killed people.
Effectively, it's failure to treat. It's malpractice on a global level, and it's malpractice orchestrated by our federal agencies that gave the guidance. I was at a major health system. I was getting the emails, do not use ivermectin. In Australia, the Therapeutic Goods Administration, the TGA, came out with its first sets of guidelines on how to treat COVID. They were a series of negative statements. Do not use hydroxychloroquine. Do not use ivermectin. Do not attempt to treat the illness. This suppression of early treatment, and that's the focus of my book, Courage to Face COVID-19. The global suppression of treatment is something I think scholars and investigative reporters will study for years and years and years. Let me give you another example. Clive Palmer, who's kind of an outspoken billionaire in Australia, had purchased a supply of hydroxychloroquine large enough to treat the entire country of Australia. Now, hydroxychloroquine, in 300 plus studies, has a modest effect in reducing COVID hospitalizations and deaths.
Is that a spray or is that a medication?
No, that's an oral tablet.
That's an oral tablet.
For malaria and rheumatoid arthritis and lupus, but hydroxychloroquine, that was the first one used, and then it was supplanted by ivermectin. But hydroxychloroquine carried the day in 2020, then ivermectin in 2021 and beyond. But Palmer in 2020 secures enough hydroxychloroquine for the entire country. The Australian authorities seize his stockpile and they destroy it.
That's shocking. That is absolutely shocking. So what countries got it right?
It's sporadic. Let's take ivermectin as an example. There's probably about 24 countries where ivermectin was in the official guidelines. It was probably about a dozen countries that had hydroxychloroquine. They typically tended to be underdeveloped countries, relatively poor, and countries that, didn't mass vaccinate the population. There are a few countries like Haiti and Ivory Coast that essentially didn't give anybody a COVID-19 vaccine.
And their death rates were one of the lowest.
That's right? Correct. So the poorest countries that literally couldn't afford the government purchase of vaccines did the best.
I remember having conversations like this with people that were all in for the vaccine and they're all in for lockdowns and they're all in for censorship. Basically, we're saying, well, look, let's look at the Africans and see how they're doing better. And the first response is, well, yeah, but they're young, right? And it's like, well, hold on here then. So a light should go on over your head. If they're young, then why are we forcing our young to get vaccinated? So
great
and that was going to be my question to you today. So right now, if I'm a college student, I'm 19, 20 years old, I'm active, I'm healthy, I go out a couple times a week, I play sports, I'm just a normal college kid. And I come to you, you're my doctor, and I say, should I don't have any of the vaccines. Should I start right now? Should I take one? What would a doctor have to say in that case?
Let's say a doctor who's in the orthodoxy, an employed doctor that is giving guidelines to follow by their employer, which follow the government. It could be Health Canada, the Royal College, or it could be, our CDC, NIH, FDA. The doctor would say, well, you should take a COVID-19 vaccine. And I can tell you as a medical doctor, indiscriminate vaccination or medical therapy is never a good idea. It should always be risk stratified. Even if the COVID-19 vaccines were safe and effective, which they're not, but even if they were, my estimate is only about 2.7 million Americans should have been a candidate for vaccination. I led a vaccine development program during COVID. It was called the Modulon vaccine, presented this to Operation Warp Speed with a co-principal investigator. And I had outlined for the country 2.7 million Americans. Now, the vaccine never made it to clinical trials, but the 2.7, who were they? Patients in nursing homes, congregate living settings, debilitated individuals, people who are really at high risk for death. Remember, a large fraction of people who died with COVID were nursing home patients. We heard about them early on, but quickly the attention shifted from nursing home patients to college students.
Immediately. And it was so disgusting. It was, if you care about grandma and grandpa, if you care about them, you will get vaccinated. Meanwhile, and you can tell me what the percentages are, but is it safer to take the vaccine for a college kid, or is it safer to get COVID as a college kid?
It's
What do the
far
stats say
safer to
right now?
get, yeah, far safer to get COVID as a college kid. We learned in a paper in JAMA from Daniels and colleagues that during the first year of the pandemic, a third of college kids already got COVID in 2020. Our CDC said by the end of 2022, 78% of people had COVID. Now we sit here today, it's 97% had COVID. The college kids largely got the illness, like the common cold. Sadly, those who took the vaccine faced the risk of serious side effects.
Wow. And what's the how bad is the myocarditis right now? Is it? I mean, nobody's talking about it. It's not in, you're not going to see it in legacy media, obviously. Is
But you
it
do
a big
see
problem?
you do see it in the peer-reviewed literature.
Okay.
Holy smokes, hundreds of papers on vaccine myopericarditis, hundreds. And before the pandemic, in my career as a cardiologist, I saw 2 cases of myocarditis in decades. 2. Now I see, sometimes a dozen or more in a week. I mean, it's so common that in 2 prospective studies, and prospective cohort's an important term, meaning that assessments are done at baseline, they're given the shots, and the same assessments are done in follow-up. Now, these are limited, but the 2 studies that exist, one by Bergen and colleagues from Switzerland, the other one by Mansugian and colleagues from Thailand, the rate of heart damage with a single shot of Pfizer or Moderna is 2.5%. I have to tell you, that's a high number when this is mass administered. And a fraction of those will develop fulminant myocarditis and present to the hospital early. Most of this happened in 2020 and 2021. 2 studies, one by Rose, of which I'm a co-author, had pegged the mortality rate of those who present early at right around 5% or so. But a Japanese paper that extended it out to about 90 days had that mortality rate closer to 10%. We're talking individuals who are 18 to 24 years old, and to have an illness where there's a 5 to 10% mortality rate. And then beyond that, what we saw is what's called subclinical myopericarditis. So then we have young people who have this, lingering chest pain, don't feel well, heart pounding, palpitations. I'm sure some of your students and listeners will recognize these symptoms. We do blood testing. Typically, nothing turns up in terms of heart damage. EKG could show some abnormalities. We do heart ultrasound. Heart pumping function is okay. Pursue it with an MRI. Can't get down to the limit of resolution to see the inflammation. Sometimes there's some fluid around the heart, and it's a telltale sign that there's inflammation there. This is called subclinical myopericarditis. Now, the manifestations can be these symptoms I described, and they can go on for years, but heart rhythm abnormalities like atrial fibrillation, which causes blood clots in the heart and stroke. I've got a 25-year-old man in my circles with this. It's like, why is he having atrial fibrillation? But I think the most concerning manifestation is sudden cardiac arrest. And it turns out that this is a relatively frequent manifestation of the subclinical myopericarditis. And in a paper that I published regarding the European athletes, we saw in 2021, a rash of European soccer players who dropped dead on the field. It was stunning to watch.
Yeah, actually, as you were answering that, I was going to say, do we have stats on how many athletes? Because you can't just go by, you see a story and it's a story, maybe part of a trend, but it may just be part of reporting, right? They just want to prop up, the news day. So there may have been deaths before, but just not reported. Do we actually have hard figures on whether or not deaths by professional athletes have gone up?
They have 2 sources of data. One is Dr. Panagis Polyakritis and myself published. And so we had time series data. regarding the European athletes, including pro, semi-pro, those active. We filtered it under age 35, it got as clean as we could. The point is, when the vaccines rolled out and the players were mandated to take it, there was a tenfold increase in cardiac arrests. And sadly, some of these occur right on the field.
Yes.
With exertion. And only about a third can be saved with immediate defibrillation and CPR. 2/3 die. Then we saw the case in the United States of Damar Hamlin, who was a backup safety for the Buffalo Bills. The Bills were playing in a very widely viewed game. I watched it live and witnessed him having a cardiac arrest after he made a tackle on a kickoff. And I was immediately called to go on Fox News. At the time, Tucker Carlson was primetime. Tucker called me and said, listen, we want your opinion. And so I went on Fox News. I said, this looks like a vaccine cardiac arrest. It looks like he probably took the shots. The NFL was mandating them. He tackled someone, got up and had a cardiac arrest. Now, I told, this is a kind of inside, behind the scenes information, is I told, this is within 24 hours, I told America, he's going to survive, he'll be okay. And I did get emails on this. They said, how do you know he's going to survive? He just had a cardiac arrest, he's on life support at University of Cincinnati Hospital. And I can tell you how I knew, is when this happened, I started getting texts from all over, and I got a text from somebody at the game, a doctor at the game, and who was watching the whole thing. They said, yeah, he got out there. It looks like he had just had some Gatorade. So when he had the cardiac arrest, there was some vomit or some fluid in his, because he saw them get the, he turned his head and all the fluid came out of his mouth. And they immediately defibrillated him. But how we knew he was going to survive was very interesting. Is once he got in the paramedic unit and he was off the field in the tunnel, the paramedic unit stayed there for a long period of time, at least 15 minutes or more, which is distinctly unusual for a cardiac arrest. Normally, the paramedics go lights and sirens to the hospital because the patient is unstable, they could have a repeat arrest, but yet it was rock stable and they were waiting in the tunnel. And I was texting my friend and I said, what are they waiting for? They said they're waiting to get his mom out of the stands so she can ride in the paramedic unit. And I said, that told me he's rock stable. He had a cardiac rhythm. He had a good blood pressure. He was on. So I went on TV. I told, listen, America, listen, I'm a cardiologist. I know this early response really matters. He's going to survive, but it looks like a vaccine cardiac arrest. And then what we saw afterwards was unprecedented. The University of Cincinnati doctors looked incredibly uncomfortable. They wouldn't say what the cause of the cardiac arrest was.
Right. Yeah.
Hamlin wouldn't say. Doctors were opining on social media. It wasn't the vaccine. Well, wait a minute. How do they know?
How could you know? You can't know that. Just like if you can't know the other way, you can't know that way. You can't know both ways.
How did they rule out the vaccine? I said, it looks like a vaccine cardiac arrest. Then Hamlin gets to his interview with Michael Strahan. And Michael Strahan, former player for the Giants, he's a TV personality. He said, Damar, you got to level with us. What caused the cardiac arrest? And Hamlin goes, I don't want to go there. Like he doesn't want to mention the vaccines. And then later on, about a few months later, he goes, I knew what caused it. It's because I tackled somebody hard and a problem called commotio cordis, which can't happen because the helmets are too diffuse. There's breastplate protectors. It's never happened in football, period. So that commotio cordis was an easy rule out. So essentially, Hamlin becomes a figure. He's promoting defibrillators for children and on and on. And the very interesting thing is myself and a cardiologist, Michael Goodkin, we wrote the Buffalo Bills and we wrote the Buffalo Evening News. And we said, listen, he's had a cardiac arrest, no matter what it was. And the standard of care is to put in a defibrillator because there's a chance of another cardiac arrest. And that would mean kind of the end of his football career because no matter what, the defibrillators can't tolerate all this hard tackling. The interesting thing is Hamlin apparently never gets a defibrillator and he returns to play. The next year, he only played like, I think, 5 plays, very lightly. The following year, he started a few games. He played safety. He wasn't particularly good. I didn't really see him doing hard tackles, but he actually played. And I don't think we'll see him in the playoffs, by the way. But anyhow, that's the interesting thing. And that matches my clinical experience, that when a patient has a vaccine cardiac arrest and they survive, if they get appropriate treatment, I bet Hamlin is getting McCullough protocol-based spike protein detoxification, which is the standard of care. It's what I've published on what to do with this spike protein in the body. And he's getting a medicine called colchicine, which I've published widely on. What's been shown is people don't have another cardiac arrest. And so I had a chance to talk to pilot Bob Snow. He was the American Airlines pilot who took a Janssen vaccine, which is similar to AstraZeneca, and he has a cardiac arrest after landing a plane at DFW Airport. And, there's a story on his case called The Miracle of Pilot Snow. And you know what the miracle was? Is he was in the jetway area or the cabin area. And you know when all the passengers leave and the pilot says goodbye to you?
Right.
He had said goodbye to the last person getting off. There was just him, I think, 1 or 2 other flight attendants. And boom, he has a cardiac arrest. And he told me when he went out, he's out. And the poor flight attendants are trying to get to the defibrillator, trying to figure out what to do. Now, normally, if there's a flight and I'm on board or another doctor, and by the way, most flights have a doctor on board. We would know what to do. We'd get the defibrillator on, but they don't have that skill. So they're struggling, and one of the flight attendants calls 911, and DFW Airport in Dallas-Fort Worth has 2 paramedic units at all times circulating. The miracle was the paramedic team happened to be at the gate next door dealing with some medical issue in an elderly lady, and they literally just ran right over to the next gate and had the defibrillator there. But it took 6 shocks to get Pilot Snow back. 6. So he was deep into a cardiac arrest.
What is it normally?
Survives. He's normally it's first shock if you can
get
it.
Oh, really?
Early.
Wow.
Oh, yeah. So I think Damar Hamlin was first shock. Anyhow, I talked to Pilot Snow. He's neurologically fine. His heart is fine. He does have a defibrillator in. And I examined him, and I asked Snow a question. I said, listen, it's been a couple of years since your vaccine cardiac arrest. And Snow came out and told people, listen, it's the vaccine that did this to me. He's never had a repeat arrest. Just like Damar Hamlin never had a repeat arrest. So Snow has the defibrillator in, Hamlin presumably doesn't. So this is a very interesting set of observations.
It's and because the rates have gone up, they actually went through the effort of putting out public service announcements saying it's not a big deal. I don't know if you saw the one, it was quite disgusting. It was a little girl. She's shopping, and this is a public service announcement. And she's basically, saying, I want to be a designer someday, blah, blah, blah. But I've got this little problem with my heart, but it's not a big deal. It was quite possibly one of the most disgusting, vile things I've ever seen. So they're basically saying to you, you have to keep taking this vaccine to a point where even if it does give you this other stuff, we're going to say this other stuff isn't that big of a deal. And we're doing this with kids.
It's called normalization. And this happens because this belief system in the vaccine is so strong. The video you're mentioning was put out by Columbia Presbyterian Medical Center in New York City. And you're right. The girl says, well, I took the vaccine. I got heart damage. I had to be hospitalized. I had to go on actually with a special blood pump called extracorporeal membrane oxygenation. It shows the pump. I mean, this is a serious illness. And she says, well, and I survived. There were billboards put on the signs of buses in the UK that said, children have strokes too. Children have strokes too. Like this is normal, this normalization of it. And then the concealment. So to this day, Damar Hamlin has not said, listen, I took the shot and I had a cardiac arrest. I want to come out and say it because every public figure that's come out and said that the vaccine caused harm to them, they have been slammed. I mean, one of the first ones that came out and said this, I had a chance to talk to him. In fact, we had dinner together, was Eric Clapton, famous guitarist.
Ah.
And Eric said he took the AstraZeneca shot. He developed a worsened small fiber neuropathy, couldn't play the guitar. Said, listen, this happened to me. And, be careful. And he was slammed. And we, in the media, and every other public figure that's come out, and
I've seen them. I've seen them all. I've seen them. They're coordinated.
Yes, and in 2021, it was interesting. When there was a vaccine death, it would come out in the news. For instance, there was a CNN African-American female correspondent, Midrin Lewis was her name, and she took the vaccine. She died the next day, and the report says patient died after taking the vaccination, must have been allergic, and it was probably a fair report. And then there was a few other obituaries of, I recall a woman from Washington State who died, and she said, well, she died of a vaccine syndrome called vaccine-induced thrombocytopenic purpura, VITT. That was in 2021. By 2022, all the vaccine deaths were then scrubbed. You would see a report, they died, cause unknown. Mm-hmm. And you say, wait a minute, there was, country music stars who, one guy died on his wedding night, cause unknown. All different types of public figures, people in general life. It got so bad that in the province of Alberta, the cause of death being unknown became the most common cause of death. And let me tell you, before COVID, the cause of death was always known. 99.9% of the cause of death is known. It falls into three major categories. One is heart disease, 40%. One is cancer. These are known heart disease, like a long history of heart failure dies. A long history of cancer dies. And then the other 20% is known other causes, like a known car accident, a known drug overdose, suicide, homicide. But now these mystery deaths, they just died. And this prompted work by former BlackRock executive Edward Dowd. And he has a book out called Cause of Death Unknown. And it's describing the most bizarre change in the human condition we can ever imagine. Large numbers of people dying, but it's a mystery. And anyone who tries to pin this on the vaccines is immediately targeted.
Yeah, you wonder how quickly we would find out what the real cause was if we just said to researchers, scientists, doctors, go ahead and research and do anything you want. We're not going to censor you, and we're not going to push you one way or the other. We're not going to push a narrative. I bet you we would find out very quickly.
Well, the research has been a struggle to do. Let me tell you what's been done. Crossan and colleagues from Harvard did get one paper through, and of people who died after the shot, they physically found Pfizer and Moderna vaccines in the heart muscle itself. It's physically in the heart. And its dangerous product, the spike protein, is abundantly there in a study by Bowmeyer and colleagues who stained for the spike protein. Now, the technique to actually find long-lasting Pfizer Moderna messenger RNA is called reverse qPCR. It is not being done routinely in autopsies. It should. The staining for the spike protein is an easy stain to do in a pathology lab, but autopsies are not routinely doing it. So epidemiologist Nicholas Holscher, who was at University of Michigan at the time, he's now joined McCullough Foundation, which is my investigative foundation. Him and myself have published a case in the preprint literature. It's now been conditionally accepted in the peer-reviewed literature of a man who takes Pfizer and about a year and a half later dies of a violent pulmonary hemorrhage and blood just pouring out of his mouth and into his lungs right in front of his children. It was just a horrific death in his living room. And his wife came to me and said, Dr. McCullough, I'm just horrified what's happened. My husband's died. And she described this gruesome death. We got an autopsy. And the autopsy says, died of natural causes. We said, wait a minute, the guy's 47 years old. He's perfectly normal with his kids, and this happens. And so we described the death, and we published a table in there of steps that coroners should do. And what we saw is even the coroners seem to be a part of this concealment. And we've seen deaths of young people under age 20, where there's no obvious explanation outside of they taking the vaccine. It says death due to natural causes.
Possible. It's the healthiest demographic on the planet. Young people, unless they're in a car accident, die on a drug overdose, or have a rare, and I'm not a doctor, or have a rare disease, right? I mean, am I wrong? You can't kill off this generation unless you give them an untested vaccine,
I can tell you as a doctor, it's very hard to kill medically a young, fit, strong person who's in their late teens or early 20s. And the case example are the athletes. The athletes are very fit and strong. These professional athletes in Europe, they're all screened ahead of time. They have ECGs, echocardiograms. They don't have congenital heart disease or coronary heart disease. And they were dropping like flies. Now, the interesting observation is, why didn't we see that among pro football players in the United States?
I have a theory. Can I tell you? Because I'm just going to guess. I'm going to guess that they actually didn't take the vaccine and that they lied about it.
Well, you may have been listening to the podcast between Aaron Rodgers, former quarterback for the Packers, and Joe Rogan.
Oh, okay.
And they talked about that. Both of them, Rodgers and Rogan, got the McCullough protocol. It got them through COVID, by the way. And they do recognize that, which is nice. But the subject came up that by the time this got to the NFL athletes, the agents were involved. In fact, one of the agents had reached out to me, one of the assistant coaches. And so people knew in the rank and file of the NFL that the vaccines were dangerous. And I think the agents and others found a way to get, in a sense, fake vaccine cards. And in the United States, by the way, there was no electronic system that anybody could verify. It was a paper card system. A lot of times the paper cards were sloppily completed. You couldn't even read the lot number. So no one could prove or disprove someone's vaccine card. And so I'm hoping that most of the professional athletes did that. I'm hoping actually most of the college students did that. Now, in the United States, I think we have about 5,600 or so colleges. I think that number's right. And at its peak, I think we had easily over 1,000, maybe 2,000 that had mandates. Now, in Texas, we're a big state, about 30 million inhabitants. We only had 4 small universities ever mandate the vaccines, ever mandate it. But, for the first year, they did unnecessarily lock down. And I'll never forget, one of my patients was the University of Texas at Austin, the main UT university. And he was describing what it was like to be locked down. And I said, gosh, it must be terrible. He goes, oh, yeah. He goes, we're in our apartments. We're taking classes online. He goes, it's so boring. No one's paying attention. And I said, gosh, it sounds awful. He goes, oh, yeah, but when we're done, we go out and play basketball. We go to the bars. We date. We have fun. So it was completely useless to lock down, right? So the students were being protected. Now, if you had an elderly professor, it would have been fine to actually, have the students in class and the professor could have beamed in up on the screen. I think that would have been okay, but the teacher assistants should have been there. And what we learned through all of this is that that the Great Barrington Declaration, which came out just a month or two after McCullough Protocol, those are the two probably most important documents in 2023. It said, listen, we don't need to lock down. This isn't working. It's not going to work. No lockdowns, no social distancing, no masking, none of that. Just special protections for the seniors. Okay, that's fine. And just go on with business as usual. And in across the world, the responses were greatly different. Sweden never really locked down. Okay, it's not a heavily concentrated area. I've been over to Sweden, but let's just compare Australia and Texas. Both widely distributed populations. We have some big cities, population size the same. In Texas, we never really locked down. We had about 2 to 4 weeks, I can recall, where we couldn't go out to restaurants. We had a varied response. In the city of Dallas, which is a big city, the public schools were shut down for a year, but the parochial schools or private schools were not shut down. Parents were paying tuition.
And they did better. I'm going to guess they did better.
No difference. They did better academically for sure. The kids in public school basically lost about a year of progress, but no different. Our big public universities, big private universities did not mandate the vaccines, did do this shutdown procedure, which was unnecessary. And what we found is that as things went on, there was a greater and greater paradox. Let me give you an example. Do you know that there are some private schools that, because they still mandate vaccination? We're saying K through 12 private schools. Now, they can mandate the full CDC vaccine schedule, which includes the COVID-19 vaccines. And the parents are in agony trying to get exemptions to try to spare their child from a COVID-19 death. And yet my mom is in a senior home. She's in a senior home. And she says they have not mentioned the COVID-19 vaccines for years.
And she's part of the demographic that's more at risk.
Right.
And they would benefit from it more.
She's 86 years old. She goes, they haven't mentioned boosters. They haven't had a table out or any nurse coming around the vaccine for years. And that fits with our observation. You don't see the seniors in the news anymore. It seems like the vaccine campaign is hyper-focused on children and young people.
Yeah, I mean, they were near the end. They were saying, and get your baby vaccinated with the COVID vaccine, which I thought it was insane. You were talking about autopsies earlier. I just sent out to about 10 different funeral homes. I just said, hey, could your embalmer, talk to me about these white blood clots? Because I want to know if it's, because you hear about it, but you hear about a lot of stuff. I didn't get one response, not one, not even a return email. I talked to one guy that I actually went to school with, high school, a friend of a friend in high school, who owns a funeral home. And he said, I don't know anything about it, but I'll look into it if you want. I never heard back from him. Have you seen some of the white blood clots? What are you hearing? Are you talking to embalmers?
Right. So there is an investigator, Tom Haviland, who's done a survey of embalmers, a pretty wide survey, and about 70% are responding, and they're saying yes, they're seeing large blood clots ante-mortem. Now, they haven't stratified according to COVID-19 exposure, the vaccine exposure, or both. But I can tell you clinically in practice, I am seeing astronomical numbers of blood clots. I've never seen blood clots like this in my clinical practice, both after COVID-19 illness, which 97% of us have had, and the COVID-19 vaccines. Now, United States, we're at probably 80% of the population took the vaccine. Canada could be upwards of over 90% took the vaccines. The spike protein has been found in the blood clots. It physically causes blood clotting. This is not controversial. COVID and the vaccines cause blood clotting. In my practice, I have seen blood clots extend from the ankle to the hip. We're talking several feet of a blood clot. If these break loose, they go to the lungs, they're instantly fatal. I've never seen this before in my clinical practice. A typical blood clot is less than an inch long, a few centimeters long. These are astronomical blood clots we're seeing, and there was a paper from the US FDA from their office in Silver Spring, Maryland, describing thousands of these blood clots, thousands from the FDA in a peer-reviewed paper, and about 11% were fatal.
That is unbelievable. I saw one that it just scared the crap out of me. It was the length of this kid's leg. So if he was alive and they had found that he had a blood clot, would they have been able to actually take that out?
It's they have to be physically extracted. It's a very dangerous surgery. I've had multiple patients that have had to have this done. They don't respond to typical blood thinners. Remember blood thinners like warfarin or apixaban or rivaroxaban, dabigatran. They just hold the coagulation system at bay and try to have the natural blood dissolving system, the thrombolytic system, dissolve blood clots. It's not working. So we're actually having to use oral blood clot dissolvers, which is part of the McCullough protocol base spike protein detoxification, and that's nattokinase and bromelain in high doses, oral, to dissolve the blood clots. Now we are seeing some success there, but I think everybody is at risk for blood clots. All of us, whether we've had COVID or the vaccine or both. Recently, someone in my family had an ankle surgery and her leg was in a cast. And I was telling her, listen, take something to thin the blood. Aspirin is a mild blood thinner. Nattokinase and bromelain are, oral supplements that are mild blood thinners, but don't get burned with a blood clot because once they form, they're very difficult to treat.
Wow. I was at the hospital getting my shot of Xolair last week, and everybody was wearing masks again. What is this? Not the funniest thing you've ever seen? Do you shake your head when you see all of the masking?
Right, but it goes against government agency guidance at this point in time. Our CDC says the only time to wear a mask is when we're facing a patient in respiratory isolation. Now, they don't say the reason why to wear a mask. This is very interesting. And I recently was on Fox News Business. I told Liz McDonald this. She was shocked. But let's say we have a patient with influenza, of which there are rising cases right now in the hospital. And I go to see a patient in the respiratory isolation with influenza. The reason why I should wear a mask is because healthcare workers get colonized with staphylococcal organisms in the nose. And if I had an uncontrolled sneeze, that droplets with staph could go to the flu patient, the influenza patient, and cause a secondary staphylococcal pneumonia. So the mask is to protect the patient from the doctor or the nurse. The same reason why a surgeon wears a mask in the operating room. Let's say a cardiac surgeon is doing surgery and the chest is open and the hands are occupied and there's an uncontrolled sneeze, the staphylococcal organisms can go right into the chest and cause a terrible infection called mediastinitis. So the reason why we should wear masks is to protect the patient, not to protect ourselves. And our CDC says you're getting a blood draw, you're getting an IV, you don't need a mask. A Cochrane review, the Cochrane group in the UK is one of the best evidence-based groups out there. Thomas Jefferson was the first author. And the conclusion was public masking did not work. It failed because the virus is too small. It passed the mask expert Richard Petty. I've presented with him. Has through his calculations, 17% of the air goes around the mask, even if someone wears a mask. And so public masking was useless, yet you still see it on airplanes. And you can see that the mask almost became a symbol of indoctrination and fear.
Absolutely. Absolutely. It was, yeah, look at me. I'm a good person. Virtue signaling. Look at that guy over there. He's scum. He's walking around. He doesn't care. He's breathing. Yeah, I mean, it didn't work because everyone got COVID. We didn't need studies to tell us that masking didn't work because everybody that you knew that was vaccinated got COVID. So that failed. The lockdowns. When I was talking to Dr. Jay Bhattacharya, he shocked the hell out of me when he said that there was evidence that just 3 days of lockdown, 3 days was harmful to
Mm.
children, which is ridiculous. I was just shocked the hell out of me. And we locked down for a year, some places half a year, 6 months. And I see the results of the kids that were in high school that are coming to college, the difference between them and the pre-COVID kids. They don't put their hands up. They don't lead. They won't talk. They're nervous. They don't even talk to each other in classroom, like just, like gossip, just talking, making a little bit of noise, every once in a while, you got to say, come on, settle down. You don't even see that anymore. It's just, they've been totally shut down.
Dr. Claudia Chaufin from York University in Toronto has published a series of papers on this. And she's concluded that this indoctrination actually worked among college students in her sociologic studies. She's doing very meticulous studies. And so this messaging to saying, listen, you're a good person if you comply with this lockdown, this masking, social distancing, and you're a bad person if you don't, that it actually worked. And so it turned out that the college students, naturally kids are impressionable. They want to be good. So the messaging actually worked. And so this has now been ingrained into our young people. If you noticed about who protested this, who was outspoken, it's almost always people in the older generations of life. Some of the most courageous doctors were retired doctors. Yeah. And we don't see any young ones coming out saying, listen, I don't agree with this. Of interest in the United States, the only employer group, the only group that protested mass vaccination was the nurses. I thought that was interesting.
That was my next question. That's amazing. My next question was, what do they know? Because I mean, you're still involved. I don't know if you're still involved right now with patients, but through COVID, you were involved with countless patients. A lot of doctors that were outspoken saying you got to get the vaccine. They weren't seeing patients, but nurses were. They were saying, you know what? I'm quitting. I'm not going to do this. You're not vaccinating me. They were quitting $100,000 a year jobs. And I was like, what the hell do they know that we don't know? And that these phony doctors that aren't even treating people, what do they know? What is it about the nursing mentality? There is something different about the nurse, isn't there? They really are. They're just the foundation of healthcare, aren't they?
They are, and interesting, it's a very gender imbalanced workforce. Yeah. About 90% of nurses are women. And, nursing and medical assistants and other women in medicine, that healthcare is the largest employer of single working mothers. By far. And there's a gender imbalance among those concerned about the vaccines, far more women than men. And I think it has to do with the maternal instinct, that survival instinct, that something seems wrong. These vaccinations are occurring, people are dropping dead, that nurses get an instinct on this. Of course, they're seeing the complications coming in, patients saying, listen, I took the vaccine, I have a blood clot, et cetera, et cetera. We know that from published studies, the nurses were some of the first to quit taking these boosters. Even in nursing homes, there's published data that fewer than 10% of nursing home workers are taking these shots. They saw what happened. They knew the vaccines were dangerous. But even as they were rolled out, the nurses were protesting. I think a lot of them saw practices that had never happened before. So for instance, if you already had COVID in 2020, you were done. There wasn't any reason to take a vaccine. The vaccines were only indicated to prevent the first case of COVID. So a lot of nurses had it in 2020. I had it in 2020. So when the vaccine came out, I said, listen, I'm already done. I already had the illness. And then we saw.
And you probably, like me, had the real one, like the early one that was like the one that really knocked the crap out of you. I lost 30 pounds. Like it really knocked me down.
I had pulmonary COVID for sure. And I can tell you that we had never just given a vaccine to somebody who already had the illness of interest. I mean, just, a few months later, here, take a vaccine. So we saw that saying, listen, no matter what, just keep taking vaccines. And There was the most odd, uncomfortable interview. I don't know if you saw it between Anderson Cooper and Bill Gates. And Anderson had had COVID like 3 times, I think Gates 4 times, and they were taking boosters. And Anderson said, Bill, are we done? I've already had COVID so many times. I've taken so many boosters. And Gates, being a non-physician, but, a vaccine investor,
Yes.
someone who's, very, very committed to vaccination, he said, well, to just be safe, we should continue to take these shots. And we did see this among, President Biden is on public record to taking 6 shots, having 3 episodes of COVID. We had never seen this before in the history of medicine. I'll tell you another thing that's never been seen before. The nurses spotted this right away, is that we never give brand new experimental products to pregnant women. Never. Never, never, never. In fact, the clinical trials strictly excluded pregnant women, said no way they should take one of these vaccines. Yet a few months later, when the vaccines rolled out, in the first week of the vaccine campaign, and by the way, the first people to get vaccinated were hospital workers, not nursing home patients, hospital workers, young hospital workers, many of whom already had COVID.
Already had it. Yeah,
and in the first week, over 3,000 pregnant women in America took an experimental vaccine for the first time. We had never seen this in the history of medicine.
It's really quite shocking. Like the more you learn about it, actually, the worse it gets. When do we need? Maybe there already is one that we don't use, but do we need a patient bill of rights? Is that something that exists or that we need? So,
There's all kinds of standards. So the Declaration of Helsinki, which is, universally followed, says that we should have full informed consent, informed consent. The Nuremberg Code says that no one under any conditions should receive any pressure, coercion, or threat of reprisal for either taking a drug or a vaccine or declining one. But we saw these standards encroached upon, and where they were encroached upon was with the routine childhood vaccine schedule. And it used to be just if you wanted to take vaccines, fine. If you didn't, fine. But then the schools started to mandate them and say, listen, you need to show your vaccines before you're able to come to school. Then colleges started to do so. Healthcare organizations started to do so, and then the military. And this crept in over decades. So this was, in a sense, preparation, or laid the groundwork to say, listen, you have to take a COVID-19 vaccine like you have to take other vaccines. So there's something very special about vaccines in the history of medicine. It's what I call vaccine ideology that has led up to all of this.
when the idiots are out there, basically, they can't form an argument. So they'll just say, well, he's anti-vax. RFK, he's just anti-vax. So I'll say, okay, well, show me the video where he says I'm against all vaccines. Show me the transcript. And of course they can't. So when they call you anti-vax, what do you say?
It's a smear tactic.
It's a smear tactic.
I counted up, I got my vaccine card from my mom, and I counted up the number of shots I've personally taken in the course of my life. The answer, 69. How can
I can't name 69.
How can
I can't name 69 shots.
How can I possibly be anti-vax? I mean, I followed the rules every year for medical staff. I had to take a flu shot. That's 40 flu shots, 29 other shots. I was excessively vaccinated as a child. I'll give you an example. I asked my mom, I said, Mom, didn't me and my older brother, Tommy, didn't we have the mumps? I recall having the mumps. She goes, oh yeah, you had mumps. You kids look like chipmunks. Your glands were swollen. I said, Mom, why did I get 4 more measles, mumps, and rubella vaccines after that? She goes, I don't know. The doctor said we should give them. And then when I went to medical school, they said, well, your titers aren't high enough for measles. Take another shot. So no one's been paying attention to excessive vaccination for a long period of time. The idea is, listen, vaccines are good for you. just take it. Let me give you another example. That's rubella, German measles. Well, it turns out that rubella can cause a terrible congenital syndrome called congenital rubella syndrome. So it happens if a rubella infection happens in pregnant women, the babies can be affected. That's the only implication of rubella, the only one. But when the rubella vaccines came out, I think you and I were probably young children then. You probably remember this. The idea was, listen, let's vaccinate everybody, even the boys and the men. Wait a minute. Why do boys have to take a rubella shot? Boys don't get significant rubella. It's like a cold, it's like a drippy nose. The idea is, well, let's vaccinate everyone. And so this goes back, this vaccine ideology or this religious belief in vaccines goes back to probably actually the very late 18th century. That's when the first attempts at a smallpox vaccine came in, but definitely in the early and mid 19th century, Edward Jenner and beyond. The smallpox vaccine essentially developed its own religion. And the medical orthodoxy, doctors were richly paid if they would go out and vaccinate people for smallpox. And that meant typically gathering the fluid, the lymph fluid from a cow or a horse, or taking another human and actually scratching them and doing human-to-human vaccination. And of course, back then, the fluids could not have been sterilized, and they were contaminated with staph and strep and tetanus and syphilis. And people died of the smallpox vaccine. They died from it, horrible deaths from the smallpox vaccine. It didn't even work. And it got so bad that parents were put in jail in the Northeast United States, in Toronto, and in the UK, if they did not get their children smallpox vaccinated. We got to the point of imprisonment. That's how bad it got in the late 19th century. And so this rose to a point in the UK where an entire city said, listen, we're not doing this. Leicester, England, they said, we're not doing this. This is so awful. They didn't do it. And of course, they made out fine with the smallpox epidemic at the time. And around 1902, 1904, finally the UK passed a law that said, listen, the smallpox vaccine is elective. And immediately about a quarter of the people stopped taking the vaccine for the smallpox. It led to the Anti-Vaccination League in the UK. There is a league called the Anti-Vaccination League. And people, in a sense, stopped taking smallpox vaccines. So, it turns out the smallpox vaccine was continued on for a long period of time. It got refined, fortunately. I took the smallpox vaccine as a kid. And then I think in 1976, we just stopped giving the smallpox vaccine. And still there's sporadic cases, but we in a sense, gave up on it, this so-called eradication of smallpox, not fully eradicated. But what a dark, ugly history. In fact, there have been treatises published about 45 years of smallpox vaccination, that it was unsafe and ineffective. And this has just gone on and on when we go into the polio vaccine. The oral polio vaccine, which I took, it actually contributed polio to the water supply. By the way, you drink polio, that's how you get it. So it actually backfired. They stopped the sugar cube vaccines, and then they gave us
the sugar cube. I remember that.
Yeah, they gave us the IPV, the injectable polio vaccine, and it turned out that during the years I received it, it was proven to be contaminated with DNA fragments called SV40, simian virus 40 fragments, which are cancer causing. So we still don't know. There's an Institute of Medicine report on this. We still don't know if people my age have cancers are due to our smallpox, our polio vaccine we took as a child. And then the worst case was the Cutter incident. So there was a lab called the Cutter Labs, and they produced an injectable polio vaccine, but they didn't kill all the polio virus. And so people got injected with polio, and it caused probably a couple 100,000 cases of polio in the Midwest, tens of thousands of people paralyzed, and some people died. They died from, and there were no apologies about this. So as we go through smallpox, polio, and on up to just the awful failed a swine flu vaccine program under President Ford, where we had about 500 cases of paralysis called Guillain-Barré syndrome, about 50 deaths, quarter of the population mass vaccinated. At least the Ford administration came out without any Twitter, without any social media, without any vaccine databases. They said, listen, we're going to stop. They apologized and they offered compensation to those damaged. So, this ugly history of human vaccination is best summarized in a book by Bastianic and Humphreys, and it's called Dissolving Illusions. I highly recommend it. It's the most cited book I've read on the vaccine debacle. But vaccination has a dark medical history, and the COVID vaccine tops them all in terms of population damage.
It tops it all. And the smear of, well, you're just anti-vax. It's like saying, nobody goes around saying prescription medications are good, right? Nobody makes blanket statements like that. Well, I've taken, I think it was called Vioxx. Well, guess what? It was great until it wasn't great. They took it off. They took it off the market, right?
Right.
So we don't make
hundreds.
blanket statements like that. Like RFK said, he goes, I believe in effective tested vaccines.
Sure. I mean, let's see some safe and effective vaccines. So it turns out that probably the rubella vaccines in women approaching childbearing age, they did reduce congenital rubella syndrome. Let's give a shout out to that. It probably did work. Let's say, the final injectable polio vaccines probably did reduce the incidence of polio. I mean, we give fair credit there. We don't have randomized trials, and there's a lot of other confounders, but they probably had a beneficial effect. But we have to acknowledge that vaccines all have consequences. I'll give you another one that probably works, and that's the chickenpox vaccine. I had chickenpox. We don't hear about kids having chickenpox vaccines anymore. Yeah. However, multiple studies show those who took the chickenpox vaccine, they get burned later on in life with shingles.
Right.
Herpes zoster. So there's a consequence to these vaccines. Do you see what I mean? So I think where we're going, and by the way, about 2.5% of the US population for decades has taken no vaccines, none. 2.5% for decades. And they tend to be the Amish, Quakers, other religious sects. They're fine. There's no outbreaks of polio, measles, or other things. Now that number, since the COVID-19 vaccine debacle, that's grown to 10%. 5 studies now showing those who take no vaccines whatsoever, they're healthier. They're healthier. They have lesser degrees of food allergies, peanut allergies, allergic dermatitis, asthma, lower rates of neuropsychiatric disorders like Asperger's, autism spectrum disorder, seizures. So, the World Council for Health in 2023, which is an independent, evidence-based, physician-led organization, they came out with guidance to say, you know what, let's stop all the vaccines. Let's not take vaccines, and let's take a breather here and see where we are. Most of these diseases, as Bastianic and Humphreys have outlined, went away with better sanitation, better cleanliness and living conditions. Because tetanus, diphtheria, pertussis, they all largely went away before the vaccines came in. The measles mortality rate went down by 98% before the vaccines. And then other illnesses for which there were no vaccines have also gone away or become manageable, like scarlet fever and tuberculosis. So vaccines have become an ideology, a religious belief. They're taken on faith. They're given way too much credit for the eradication of infectious diseases.
Dr. J was talking about the death threats he received and all the pushback that he got. On a human level, if we can just talk a little bit about that must have been tough, right? Like, I mean, you always on every interview, you seem put together and seems like it doesn't bother you, but I mean, this must have been one of the worst times in your life on a personal level, or not?
I never could have anticipated that 5 years of a pandemic would have happened and a disastrous pandemic response, and that it would influence the arc of my career. And prior to all this, I had a wonderful life as a professor of medicine. We had a big research team, grant funded, did everything I should as an academic physician. I lectured all over the world, the editor of two major journals. Published a chapter in the Bible of cardiology called Braunwald's Textbook of Cardiology. I could not imagine that a 5 year period of time would happen and the entire arc of my career would change. And, I would evolve into a public figure. I've testified in the US Senate, the US House of Representatives, European Parliament. But I will tell you this much, is that my work as a clinical scholar and a doctor has never been more important. The public health impact that I had through the McCullough protocol, the first most widely used early treatment protocol, it's been credited with sparing tens of millions of deaths and hundreds of millions of hospitalizations due to COVID. This is an extraordinary ramification. Now McCullough protocol-based spike protein detoxification, and I copyrighted these in my name for a reason, not for financial purposes, but for accountability. Because if these principles didn't work, I would hear about it in social media. I got one of the biggest Twitter accounts out there. Believe me, I'd hear about it. People will immediately tell you when you're wrong or something doesn't work. I get accolades every day. Thank you, Dr. McCullough, for coming up with an approach to get us out of the problem of taking a vaccine or having long COVID. So in many ways, I guess I'm grateful that it happened at this stage of my career, where I'm late stage. But before retirement, if this would have happened when I was a young doctor in my 20s or 30s, I honestly don't know what I would have done.
Yeah, I had colleagues who didn't want to take it, were adamant about taking it. Single mom, two kids, has to teach. And it wasn't a decision that was made lightly. You can see the pain on their faces. You can see that they're really, really struggling with it. And but I mean, at some point, like early on, don't you feel like you're just kind of alone? Like, isn't it dark and bleak? Like, how do you push through that if you're giving advice to, because there's a lot of people who have red lines, but not really, right?
When it comes to personal health and your bodily integrity, I'm grateful that I saw the line early. And I'll never forget in 2020, early on, when I was texted and then called to come out in the lobby and get my COVID-19 vaccine. This is December of 2020. And I said, listen, I just had COVID. I just had it. Well-documented case. I said, I don't need the vaccine. And then the push was, well, get one anyway. I remember coming home that day and telling my wife, I said, I think this is the line. This is the line. The line is the vaccine. It's a genetic vaccine. It's a genetic code. We don't know what's going to happen in the body when this is injected. We don't know what turns it off. We definitely know this spike protein is dangerous. This thing causes blood clots, heart damage. This was already well known. I said, this is the line. This is the line. And many days I thought, boy, I wish I could take a sabbatical for about 5 years and come back or close the blinds for 5 years and then open them and see where we are. So I guess by December of 2020, I knew we were in for a rough ride. I'm so grateful I did not take the vaccine. My wife didn't take the vaccine. My daughter didn't, thank the Lord. My son, however, is a young doctor, he did. And we worry about him greatly. I worry about every person in the world who took one of these vaccines. I testified in the US Congress now about a year ago. And I said, listen, following the FDA statements on this, we have 5 to 15 years of concern for someone who took one of these vaccines. And we're talking Pfizer, Moderna, AstraZeneca, or Janssen.
So if you got, you got the vaccine, you got a couple boosters, and COVID essentially kind of over now. And people are like, oh, I guess I got out of it okay, I should be all okay. But from what you're saying right now, it's like, no, you're worried for 5-10 years longer.
I just had a patient yesterday who I talked to. Now, he's a retired executive, early retirement, has some background medical problems that, reasonably managed. He took a vaccine, took several vaccines that worsened his blood pressure. That's common, by the way. Well, he just contacted me. He says, I just had a seizure and I was hospitalized. I've never had a seizure in my life. And I tell you, people just don't end up with seizures in their 60s or early 70s. I mean, unless it's a brain tumor or a stroke or prior head trauma, and it was none of the above. It's the vaccine. In the peer-reviewed published literature, the vaccine causes nuances, seizures, or epilepsy. It causes blood clots. It causes heart damage, cardiac arrest, autoimmune problems, paralysis, stroke. I mean, all of these are there. I'm an editor of a major journal right now. I'm in the business of academic publishing. I will tell you, it's my estimate that only 1% of the peer-reviewed papers on vaccine safety events are getting through. The majority are blocked at the institutional level. So I can tell you, at a major institution, let's say University of Toronto, and a faculty member has a very good study about death after vaccination, that would never get approved by the chairman of the department or the research administration to be submitted for publication. Why? Because the university mandated the vaccines. The university encouraged the vaccines. They would not be caught with the university affiliation on a paper saying the vaccines are causing death. So the suppression at the institutional level. Then when we get to the editorial board and reviewer level, I've had papers on vaccine safety that get submitted where all of the associate editors refuse to handle the paper. They won't even touch the paper. That's how concerned they are about this. And then on top of that, I've had papers finally get through the publication, copywriting, contracting in the National Library of Medicine, part of medical history. And then after a month or two of heavy citation, they get retracted for no reason. I've had this happen multiple times. So with this experience, I can tell you, of the 4,000 papers showing the vaccines are unsafe, that's probably 1% of reality. The reality is probably 400,000 papers. That's how bad these are.
Yeah, I mean, they got the universities, they got the teachers, they got the CDC, the FDA. Everybody was in on the narrative. The politicians were in on the narrative. Medical community was in on the narrative. And if you stepped out of line, like even if you were like Russell Brand, for crying out loud, right? The guy does a show, talking about yoga and stuff. And within one day in the Washington, I think it was the Washington Post, there was 2 articles in the same day, basically trashing him and bashing him. And on another site as well. It's so coordinated and it's disgusting. And then they'll pick people like Peter Hotez, let's say, right, as their guy. So I'll ask you a question and all of a sudden you're hitting me with stuff that I don't understand and you're hitting me with stats and you're talking about studies. Somebody like Peter Hotez comes out and just says something generic like you have to get it if you want to live or if you want to protect grandma and grandpa or if you don't want to die. And they're just generic statements. There's no science behind it. They don't talk about studies. And then they just call anybody who doesn't agree with them anti-vax. And the narrative, it's so obvious what the narrative is. And what they did to people like you, Dr. Malone. Did you guys all have did you have kind of a support group at the beginning when you guys were all kind of getting... Well,
I started a Google group called C19, which is probably about 4,000 prominent scientists across the world. I've organized academic groups. I'm the most published person on the pandemic, on this critical aspects of it, among those who you mentioned. And I published now the most popular Substack called Courageous Discourse Substack, which has been going now for over 2 years. And so I reach millions of people per day, tens of millions, maybe even more. So I have a big footprint, and you drew the comparison. So I have cited dozens of papers on this interview. And do you know Anthony Fauci, Peter Hotez, Leanna Wen, Deborah Birx, any of these surrogates for this false narrative? They don't cite a single study. And when I testified in Congress about a year ago, I testified just, I think, 2 days after Anthony Fauci, same committee. And I 3 hours of being grilled. And I was prepared. I was pinpoint, citing first author, every paper, which an academic physician should do, by the way. I'm just doing what I should do. And I asked the committee, I said, you just listen to Anthony Fauci just ahead of me. I said, I bet he didn't cite a single paper. And the congressman looked at me and said, no, Dr. McCullough, he didn't cite a single paper. So let the public judge who is an accurate source of information. And I've been true to the literature. On our Substack now, we list over a dozen studies, first author showing the vaccines increased mortality, not decreased mortality. And we put out a tweet in response to Peter Hotez, who is an acknowledged vaccine promoter at Baylor College of Medicine in Houston. In fact, he's slightly junior to me in terms of number of publications. And I messaged Joe Rogan. I said, Joe, listen, I'm in Dallas. Hotez is in Houston. Why don't we meet in Austin at your studio and we'll review vaccine safety? And Rogan says he won't do it. He won't face you. Do you know, when I testified in the Senate and Congress, Fauci is supposed to be there, as well as others in the White House task force, the U.S. Surgeon General. They're all invited. They refuse to face me. They refuse to face the data. Recently, Hotez made the false claim that the vaccines saved 14 million lives. It's a
You're
false
allowed.
claim.
It's okay to lie for the establishment. It's okay to lie on legacy media for the narrative. So when Omicron basically wasn't killing anyone, the one guy that was on Rogan, the one doctor there that made a fool out of himself, I forgot his name, is Gupta. Was it Gupta? Comes out and says millions of children are dying of COVID. It's like, where do you get that stat from? I know that's not true.
Well, it was so bad that this got to the Supreme Court. There's some COVID-related issue, and I'll never forget Supreme Court Justice Sotomayor said some large number of children were hospitalized with COVID and on ventilators and dying of COVID. It was complete hyperbole. It was a falsehood. So what we've seen a falsehood. Even FDA commissioner, who's a cardiologist, Robert Califf, outgoing FDA commissioner, even he has said that the vaccines saved millions of lives. Well, let me tell you this much. The package insert for the COVID-19 vaccines under benefits section, now this is regulatory language, doesn't make the claim that the vaccines save lives. So we even have an FDA commissioner out of school. The FDA can never make a claim on a product that's not listed in the FDA package insert. And yet it's happening now. So we're seeing, widespread fraud, malfeasance. And I do believe it's all for the vaccines. Everything we've talked about, including the suppression of treatment, the creation of undue fear and lockdowns and all the social strife and tension, all of that was to prepare and then drive the population into mass vaccination, which to this day has not stopped. Not a single country has pulled the vaccines off the market. This is an extraordinary observation. 4 years into a mass vaccination debacle, and not a single country has said, wait a minute, we're going to stop.
So maybe you can explain the headline that I thought I saw. So I must have misread it. That said there are now 20 countries that have they just taken it off of their list of treatment for COVID, but it's still available? Because I thought I saw that a 20th country just said they're not going to do it anymore.
No, there are, I think the North Group, led by Vibeke Manichi in Denmark, has gotten 20 countries, or at least representatives from 20 countries, to ask for the vaccines to be pulled off
Ah,
the
okay. Asked. Okay.
market. World Council for Health has said pull them off the market. Association of Physicians and Surgeons and McCullough Foundation, we have a peer-reviewed manuscript listing every organization and then every public figure who's calling for an improvement. But the regulatory agencies themselves, Health Canada, the US FDA, the MHRA, SAFRA, TGA, EMA, all of the regulatory agencies, not a single one has pulled them off the market. Now, AstraZeneca has voluntarily pulled it off because of blood clots and they were in a court damage. Janssen, which is identical to AstraZeneca, they also withdrew. But you still have Pfizer, Moderna, and Novavax out there. And then in China, in South America, you have the Sinopharm and CoronaVac vaccines. So we're in a situation where to this day, there still is no admission of wrongdoing.
Still no admission of wrongdoing. Let's end on a happy note. Through all of this, you've gained probably better colleagues, better friends. And in the space of YouTube, you've met some really good people, actually, people that have honor and integrity. I don't know if, I mean, you went on Jimmy Dore.
Yeah.
And I couldn't believe, like, the reason why I started watching him early on was because he was funny. And he starts talking about the vaccine. And I'm like, how is it that this pothead comedian, that's how he's self-described, actually knows more than some of these other people? And it was just shocking to me. But people like Jimmy Dore, they've been good to you. I don't know. Did you go on Kim Iverson?
Yeah, I've been on Kim.
Kim, I mean,
listen,
she's amazing.
Who is the team of media people, both mainstream and independent media, that understood there is a false narrative, and it was all based on worldwide mass vaccination with dangerous and deadly vaccines? Who figured this out? Okay, so I'm admittedly probably the most prominent doctor who's treating patients. I've got the biggest Twitter account of anybody seen examining patients, and I've published the most on it. Okay, so you have me, but Tucker Carlson. Tucker, when I went on his show, he says, my mind is blown. He went on a journey after that, ultimately lost his job at Fox News and became an independent journalist. Joe Rogan, I set all the records on his show, still to this day, beat Elon Musk, beat Trump. Joe Rogan nearly lost his Spotify contract, but he stayed on it. Aaron Rodgers, ostensibly at the time, the number one quarterback in the NFL, he is reprimanded by the Packers, ultimately traded to the Jets and what have you. Novak Djokovic, the number one tennis player in the world, he is tarnished, can't participate in the Australian Open, what have you, but he sticks to his beliefs. Eric Clapton, the number one guitarist in the world. Look what happened to Eric. He's absolutely slammed because he comes out and he's honest about the vaccines. And then you look at the independent media journalists, Kim Iverson.
She lost her job. She lost her job over it.
Yeah. Ivory Hecker. Person after person lost their job. Laura Logan. You can go on and on of people who lost their jobs because they weren't going to go along with this false narrative. So what we've learned in this exercise is most of the people who stood up were top people in their field. Okay, number one. And number two, they had courage. That's the reason why the title of my book is Courage to Face COVID-19. I've got a chapter on Joe Rogan. I've got a chapter on Tucker Carlson, how I met all these people. When you participate in life and you do a college application and a graduate school application and a job application, there's no checkbox for courage. And I never characterized myself as a courageous person. I do think police officers and firemen and people in the military, they have to be courageous to do those jobs. As a professor and a doctor, I didn't view myself as particularly courageous. But what I've learned is courage does matter. Yeah. And in the end, listen, when we go back and look at this or 10 or 20 years down the line, I don't think you and I are going to regret the positions that we took. Every day we're strengthened by not only being right, but also having the moral fortitude and the courage to tell the truth.
Absolutely. The farther you get away from from point zero when everything started, the better you feel about all of it. And it's like, wow, I'm glad I made that decision. And you forget how hard the decision was at the time. I think that's a great way to end it because I think, especially at the college level, we need more courage, not just from our leaders, but we need to develop courage in students as well. Um, Thank you for everything that you've done. I can't believe you got the most views on the Rogan show. So I interviewed the guy with the most the most views on Joe Rogan. So that's a feather in my cap.
There you go.
Thank you so much. I'm going to pause so I can say goodbye to you off camera. So from everybody that's going to be watching, thank you very much, Dr. Peter McCullough.
Thank you.
So I hope you all enjoyed that. We need leaders that are willing to be courageous, come out and speak against establishment narratives. And these are the kind of people that I like to interview. So I hope you guys enjoyed that. And until next time, take care of yourself and be safe. Cheers.